This is a really difficult question to answer, and the reason is because there's not just one type of osteo, and when you try and compare osteo to the other healthcare practitioners or professions, then there should really be no difference. And the reason is because all healthcare professions should be aiming to be evidence-based, safe, ethical, and effective. So there's no reason why an osteopath can't use techniques and procedures that physios use that are safe and effective, and there's no reason why physios can't use some osteo techniques, and the same goes for chiro. So I actually hate the title. I think it's important to have because it shows that people have done qualified training and they're more likely to be safe and effective and ethical. However, I feel like what people should be asking is, who should I see? Who's skilled in knee injuries? Who's skilled in lower back pain? Who uses the correct approach of using both exercises, hands-on manual techniques, as well as general lifestyle advice? Who's not going to take advantage of their position of their medical knowledge and misleading people? They're the questions you should be asking, rather than saying, oh, what's an osteo? Because you can't define, what an osteo does, and you can't really define what a chiro does or a physio, because everyone treats differently. And everyone has different skill sets and different knowledge bases. So when you have an injury, you should be asking your friends and family for recommendations of people that kind of fit that kind of philosophy and model. And then when you're speaking with the practitioner, ask them how they treat and what sort of procedures do they use, and make sure that they do use exercise and hands-on techniques in combination. And that's the best advice I can give you.